About how Rotary took a chance on this program. That's not the first time that they've done that for mental health first aid. In fact, our guidelines project started when we hadn't been successful in getting funding from more traditional sources, but Rotary looked at it and said, this is a good project that's going to have an impact on the community really quickly. Go for it. And that funded actually my postdoctoral research actually for 3 years. And again, it meant that we could then show the results and people would say, okay, I'm prepared to fund that. So Rotary has had a profound impact.
Too, that the Rotary and the clubs and all their fundraising do have this incredible global impact, and the spread of mental health first aid is one of the success stories. But I think from a personal level, it's changed lives as well, especially lives of researchers. So as a female with young kids and lived experience of mental illness, it's incredibly difficult to work in the academic space and apply for research funding. We're very disadvantaged in the mental health sphere because medical research is often geared towards cancer prevention and heart disease and a whole range of other really important illnesses. And so to have a space like what Australian Rotary Health creates to apply for funding and put that on your CV as a young researcher, that's just an incredible leg up into the world of research. And without that kind of stepping stone, it would really disadvantage our careers incredibly. So I think it's true to focus on that massive global impact and the population mental health impact, which has been phenomenal. But I think, like Claire talking about her PhD funded research, I received thankfully PhD funding from Rotary as well. It really changes researchers' lives for the better as well.
Definitely. Firstly, I'd like to reiterate I'm most grateful for having the opportunity and the funding by Rotary. I also appreciate it's highly competitive because the primary reason is that it's an ongoing story here in this country and now internationally. Mental health research is not well funded. There's a great need. Although we are making breakthroughs with a lot of programs, there's still gaps. So for example, that's why there are now derivatives of, say, the Cool Kids program targeting specific populations. So I think it's such research, Rotary provides a great stepping stone. One, it gives us a great scientific foundation to first test the preliminary sort of programs in the initial RCT trials, which is a springboard to further research. So that is really vital in terms of enhancing the mental well-being of Australians across the lifespan in this country. So that's why I'm very grateful, and yes, I would be encouraging any person around Australia, if they can, to sort of donate to such funding bodies, most definitely.
The research leads to this huge dissemination process where many, many families get the intervention way beyond just the research. So I think that's one of the things that I hope that Rotarians can keep in mind, is that the flow-on effect from what they fund is, $200,000 or $300,000 of funding a research trial over a number of years leads to a huge wave of a program going out to the community and then being used. So it's a relatively small amount of money, although very hard won and hard earned and raised. But the flow-on effects are phenomenal to the number of families who are affected. I'm constantly receiving feedback from professionals saying, we've just run our 12th program of tuning into teens. The feedback is amazing. I just wanted to let you know our parents are constantly saying that. Or in New South Wales, where they're delivering the kids and teens to families where children are about to be removed, and they're now into the hundreds of families who are receiving the programs. The intervention is having an effect of keeping families together. This is the outcome of having done the research to then allow professionals to use a program. And I just think that's amazing.
It's really, I don't know, sometimes I think about the work that we've done, particularly the Rotary funded work, and I think about Sunday mornings when I was a kid helping to set up a trash and treasure market in a supermarket parking lot, at 6 o'clock in the morning and complaining that I'd really rather be at home. And now I'm actually immensely proud to have been a part of something that has made such an enormous impact, and that I can really point at all the moving parts of that. It's amazing.